Thanks very much for coming along today. So today's talk is around exercise, strength, balance, but we're also going to talk about what, how, why you should exercise, and particularly how you deal with pain when you exercise as well. So feel free to ask any questions as we go along, but we'll also have some time at the end for some question time. So physical activity and exercise is not the same thing, okay? But both are beneficial and both are necessary. Come in, ladies. Physical activity is beneficial for everyone and also people who have arthritis, okay? Particularly osteoarthritis. Neuromuscular exercise, we'll go through that a little bit later, is very beneficial for those people who have osteoarthritis. So the World Health Organization has the 30-20-10 recommendations. So everyone should aim to be physically active for 30 minutes a day. Okay? How many people are physically active for 30 minutes a day? Every day? No? At least twice a week, right? So twice a week, those exercise bouts should be 20 continuous minutes, okay? And either maintain or increase intensity. So you've got to be working hard in that physical activity, all right? And 30 minutes can be done in 10-minute bouts, so you can have a little rest, okay? So moderate to high intensity is activities that should be done in addition to your everyday activities. So it's not like you're walking to the shops, okay, or walking the dog. It's something separate to that, okay? And they should feel like you've done work when you've done it, okay? So often we see it as patients, we say, well, what do you do as a physical activity? They go, oh, I walk around the shopping centre or something like that. Doesn't cut the mustard. Okay, it's about going for a walk and actually raising your heart rate, getting things moving a little bit extra, okay? It's about, with exercise, it's about stressing your body. So you want to slightly stress your body, and then your body gets what's called adaptation, okay? And as your body adapts to the exercise, that exercise becomes easier, and then you start to increase the intensity. So that's what the World Health Organization recommends. Strength training. Strength training is a type of physical exercise that specialises in the use of resistance, so weights or rubber bands, sometimes body weight, okay, to make a muscle contract and build the strength. It'll also build what's called anaerobic exercise, endurance, which is the body's ability to exercise without having to use oxygen. Okay, so that tends to be faster type activities. And it also increases the size of your muscles. So there's some terminologies that you may have heard in terms of strength exercise. Repetition max, or sometimes you might see an RM on your exercise sheet. Okay, has anyone seen that on their sheet before? Yes? No? Not really? So RM, rep max, is the maximum weight that you can lift for a single repetition of an exercise. So that might be, okay, can you pick that up off the ground? And you know, if it's this, I can probably pick this up 1,000 times, okay? But if it's some of those weights, you know, there's going to be less. So it's how many you can do in one go. And the person who's designing your exercise will use that as a guide as to then how many exercises you can do for your exercise program. Repetition, or commonly known as reps, okay, is the amount of times the exercise is completed. So you might hear you need to do 10 reps. 10 reps means you need to lift that weight or do that exercise 10 times in the group that you do. And then there's sets. So a set is how many times you do that grouping of exercises. So you may see something like this, which could be really confusing to you. 3 by 6 of 70-80% RM 2 to 3 times weekly. Does that make sense to people? So what that means in English is you'll do 6 times lifting of 70 to 80% of the weight. So let's say your max is 100 kilos, right? So you'll lift 70 kilos 6 times. Then you'll have a rest, and then you'll repeat that 3 times. Okay? So that's what you might come across, the RMs, sets, reps, when you're reading an exercise program. 2 to 3 weekly is how many times a week you'll do the exercise. When you're doing strength training exercises, you need time for your body to recover, because often you'll feel a little bit sore after you've done your exercises. And that's a good thing. That's how we get that adaptation that I was talking about just before. So often we'll do our exercises maybe a Monday, maybe a Wednesday, maybe a Saturday. Okay, so you've got a couple of days in between where you can allow your body to recover. Because if you do strength training every day, you'll get sore, but you can also hurt yourself because you're not giving your body a chance to get better from doing the exercises. Endurance training. So endurance training is a different type of training. It's also called aerobic exercise. Okay? And endurance exercises include activities that increase your breathing and your heart rate. So they're things like walking, jogging, swimming, biking. So they're lower intensity, they tend to go for a longer period of time, and they'll start to get your heart rate up, and so it's a bit harder to talk. So endurance training is really good because it keeps your heart healthy. That's a good thing, right? Helps in weight loss, improves mood and sleep quality. It prevents age-related decline in brain function and leads to a longer life. Okay? So endurance training is really good for us. You need to aim for more than 30 minutes of continuous exercise. Okay? And you should be trying to go for endurance training about 5 times a week. Okay, so it's like going for a nice walk, or it could be a bike ride, it could be the cross trainer or swimming. There's lots of different ways, and you can mix it up. Okay, it doesn't have to be the same thing every day. There's things called interval training. So sometimes you can work on endurance training by doing interval training. And interval training is you might, say, go onto an oval and you walk quickly for 1 lap, and then you walk slowly for another lap. And then you walk quicker for the next lap, so you're doing up and down. And that means that you're working in peaks of high level, but then you're giving your body a chance to recover, because if you keep working at a high level for a long period of time, you run out of petrol, and then you can't keep working for that 30 minutes. So we can work at high level, switch on, low level, switch off, on, off, which means we work our body at a higher intensity over that, say, 30 minutes than if we're just doing it a lower one, and it's a really good way of building fitness up. The talk test is a really good way of working out if you're working hard enough. So if you're going for a walk and you can talk to the person next to you and have a good old conversation, you're not working hard enough. Okay? If you go for a walk and you're walking hard and you can't talk, you're probably working too hard. Okay? So what you've got to do is you've got to be able to walk where you can talk, but you might have to stop and have a little breath every now and again. So the talk test can be a really good way if you don't have a heart rate monitor or a way of checking what your heart rate's doing as whether you're working hard enough. So it's quite confusing, isn't it? It's hard to work at a level that's not too high and not too low. We like Goldilocks, just right, sort of in between, that you can work at a level where you'll get an improvement in your physical function and your physical fitness. Balance training. So as we get older, our balance tends to drop off. And a lot of us don't really think about doing balance training. And a lot of us don't like to do balance training because we feel unsafe when we do it. And the problem with balance training is you need to be almost on the edge of falling over in order to get the training and get the benefit of the training. There's no point in me doing balance training here. I'm not challenging my balance. So you need to be, on the one limb, with your eyes closed perhaps, so that you feel like you're going to fall over. Every one of us can always improve their balance. It might not mean that we're going to be able to stand on one foot with our eyes closed, right? But that might mean we put ourselves in a challenging position. Because what happens is, as we start to lose our balance, we start to remove those things that challenge us from our daily living. And what that does is it takes us down another step. And then all of a sudden we remove something else. And it takes us down another step. And then we're having to use a walking frame. Or then we don't go out anymore because we don't feel confident, and then we're stuck in a chair. And that's a real slippery slope. So work your balance, because you can improve your balance. You can challenge your balance and make your balance better. And it makes life a whole lot easier. Hands up here, anyone who goes to Fed Square and doesn't like walking on the cobblestones. Right? So there's stuff in life where we actually don't really think about, oh, my balance is okay, but sure, when we're on surfaces like this, but if you have to walk down a laneway in Melbourne or somewhere like Fed Square, or walk across a park, okay? Sometimes footpaths. Sometimes, it's because it's a bit darker and you can't see so well, okay? So balance training involves doing exercises that strengthen the muscles that help to keep us upright, including your legs and your core. Okay, so our core is this area around here that is our back brace. Okay? But balance also involves the receptors in our eyes, our ears, and our joints. Okay? Gait and balance disorders are common in older adults and are a major cause of falls in this population. Okay, falls are falls are our enemy. Because falls, we start to break stuff. And then we have to rehabilitate from that, which means that muscles can get weak, and it's a big old vicious circle. Other common causes of balance failures include arthritis, orthostatic hypertension, which is as you get up, your blood pressure drops. Okay? However, most balance problems are multifactorial. Okay? It comes from a lot of different things. So as I said, our balance comes from our eyes, our ears, and our joints. Anyone been seasick before? Yeah, seasick, right? Or motion sickness. So that's because we get seasick because our eyes are telling us that things might be still because you're looking at the boat, but your ear's going, oh, no, all right, I'm moving, and it doesn't like that, okay? So our eyes tell us what things are doing. Our ears will tell us how things are moving, okay? And our joints will tell us what position our body is in. Shut your eyes for me just for a moment, okay? And bend one elbow up. Now don't look at it, put the other one in exactly the same position. Now have a look at it. Are they the same? They're pretty good, yeah? And that's because our brain knows, because our muscle receptors in our joints and in our muscles tell us what position things are in. Now when you have an injury, okay, we lose that a little bit. So all of a sudden, that feedback from, say, my foot, when it says my foot is rolling over, it doesn't talk to it quick enough, okay? So a couple of things can happen. I can go over, and instead of the muscles that bring me back working quick enough, it doesn't happen quick enough, and too late, I'm over, okay? Or, okay, it's not strong enough to be able to do that for me. So it becomes those reaction times. And then we also have what are called righting reactions, which, you know, when you stub your toe on the footpath and you kind of go and you'll catch yourself, that doesn't happen anymore. You know, I'm sure you know people who've done that and gone straight on their face, okay? Because our bodies aren't quick enough to react. But we can train that. We can train our body how to, with reaching, relearn how to do all that before again. Okay, so it's a really important thing as we get older to work on our balance. Challenge yourself if you do classes. You can use wobble boards. You can do reaching stuff. Tai Chi, is a really good way of actually reaching and teaching our body how to move within its base of support. That's why it's a really good form of exercise. So a lot of these are really simple. Things like tightrope walking. So imagine you're on a tightrope. Pick a line on the floor and walk one foot in front of the other. Okay? Balancing a wand. Probably going to be too heavy, but like balancing something like a stick or a walking stick on your hand, right? Because I have to move around and work at doing that balance. It doesn't have to be something big like that. Standing on one foot. Okay? Just practice standing on one foot. If that's easy, stand on a cushion so it's a little bit wobbly under your foot. If that's easy, stand with your eyes closed, so remove your eye. It's hard to remove your ear, you have to put a lampshade on your head, so no one likes to do that, it looks a bit silly. But you can do things that are going to challenge that. Walking on your tiptoes, walking on your heels. Okay? They're all ways of decreasing your base and making it harder. If you're really not confident, talk to someone, have someone supervise you. But you can do balance exercise in a corner. Right? So if you hang on when you do balance, it's not going to work your balance. So you have to be almost falling over. But if I do this here, I've always got that touch point. Okay? So I'm working my balance, and if I feel like it's there. Or a chair or something like that. You have to work it at that level. Okay? If you work here on doing balance, you're wasting your time. Okay? You're not actually challenging your balance. Neuromuscular exercise. So this is a little bit of a tricky one. This is a new one. Okay? And this is how we teach the body to move so that the muscles are talking to itself. Now, we follow patterns by nature, okay? But it doesn't mean that the patterns are the correct patterns. And particularly if you have arthritis, right? Anyone here got arthritis of their knee? Right? Do your knees drop in, or does it go out? In? Right. So what happens is, the knee learns to walk in this way, okay? We walk here. Right, and sometimes it's hard to change that because the bones and the muscles are working that way. But what we have to do is to teach it to come back out again into the correct position. And what neuromuscular exercises do is they improve the ability to generate the muscle firing pattern and the joint stability in the right angle, okay, in the right pattern. So we do things like slides, okay? Shoe off, right? So we do slides where it's this knee here, so the knee wants to go here, okay, when I do it. If I've got arthritis, we teach it to come back out here, okay, so that it moves, so that when we start to walk again, the knee knows the right position to actually be in. So it's kind of like walking again. It's a really hard thing to do. But if you think about it, if you've got an arthritic knee, for example, and you keep walking in it in the wrong pattern, all you're doing is reinforcing the pattern and the pain. All right? So it's about teaching the muscles to work in a different way when you exercise. And so we use mirrors, all right? So that when we're walking, we go, okay, that knee's in the right angle, and reteach it working that way. Okay, so sometimes it's about teaching a muscle to work and be strong, but sometimes it's about teaching a muscle to contract in the right firing pattern so that it works in the right way. Why should you be physically active? Lots of reasons. Helps your blood pressure, helps your cholesterol, helps your sugar, helps your fitness, helps your muscles, your bone, your cartilage, your weight, helps improve pain, helps improve mood. There's nothing bad in there about exercise. I say it's the exercise you don't do is the bad exercise. So what is physical activity? It could be bowls, it could be golf, walking, cycling, swimming, water aerobics or hydrotherapy, dancing, aerobics, strength training. There's lots of alternatives. Everything is better than nothing. Probably preaching to the converted here though, okay? You need to find what you like to do. So I'll ask my patients, well, what do you like to do? Do you like to go to a class? Do you like to exercise at home? You don't like going to the gym with all the other people around. It's about finding the thing you like to do because you'll do it. Okay? There's no point saying, I'm going to run laps of the oval, when you know you're never going to run laps of the oval. Okay? But you know, you say, oh, gee, I really like going to the pool with Margaret. And yeah, you might talk for half of it, but at least you're going and you're going to the pool. And you might be doing half of something which is better than nothing. Okay? So find the thing you like. Sometimes it's really good to do it with other people because the day you don't want to do it, they're going to talk you into coming and you'll do it. And the day they don't want to do it, you'll talk them in, and so you'll end up doing much more. So the social aspect of exercise is sometimes really important and really good. Hands up who's got arthritis. I'd say most of you, right? We all do. From 18 we start to wear out, okay? Cartilage actually needs load to be healthy. Okay, so if we live in space, our cartilage and our bones become really unhealthy. Okay, so movement and exercise is really good. Movement and exercise helps to improve our joint range of motion. It helps to improve our joint stability and function. Okay, and it helps us to have better confidence in our joints as well. So it's really important. We hear people call arthritis wear and tear, and so they say, oh, I don't want to move because, you know, I'll get wear and tear and it'll make it worse. No. Current research says you need to move it. You need to find the balance, yes, but you need to move it because if you don't move it, it gets weaker, it gets worse, and then you're in a big vicious circle.
What about if your cartilage is just about gone?
No, there comes a point where, you need a joint replacement, okay? But, no, the current research sort of says you still got to move it. And there's now programs like the GLAD program where there's been a lot of research into it. GLAD, which stands for Good Living Arthritis Denmark. Okay? It's been in Australia for a couple of years. We're actually going to be starting it here. Hopefully by the end of the year. We've just got to get some stuff together. And it's a program, the GLAD program is a 6-week, you come twice a week to it, and it's some specific exercises, including the neuromuscular stuff, that teaches your body to move, but no, your body will respond really well to arthritis. With arthritis, there's other things like weight loss and things that are really important as well. But no, you need to move, okay? It does get to the point where the bone is worn away so much that there's nothing you can do, and it does get, everything hurts. But there's very little, sort of place to say, no, you need to do nothing. You should be doing something. Okay, balance. So here, cartilage benefits from a suitable load. So nothing, no good. Too much, no good. So it's about finding that right balance, okay? And we talked about the alignment before, okay? So it's like your tyres on your car, okay? Whether they bow out or bow in, it's going to load part of the joint. The joint's made to load sort of equally. So if we walk in a funny way, it's going to load one part. Okay, so we want this, not this. So well aligned, controlled, quality, and it's individualised. All right, so what's good for you is not good for you. Okay? Pain is okay. Okay? Pain is okay. we can go up to a 4 or 5 in pain when we're exercising. Right? So if you stop when it starts to hurt, you're always going to stop and you're never going to be able to adapt. Okay? We don't want to be up here. We don't want to be at a 10 for pain. Okay? But a little bit of pain, physios, we're a bit sickos. We talk about good pain and bad pain. So good pain is a working pain. All right? It might hurt for a little bit after, but you rest and it goes away. Bad pain is more like someone stabbing you. It's a different pain. You can generally discern between the two. That will tend to linger and it's probably there for another day or so. Okay, we don't want to be pushing into bad pain. Okay? If you're getting pain, particularly the bad pain, it's worth checking it out. Check it out with your doctor, check it out with the physio, and they'll be able to tell you why you're getting that pain. Exercise progression is really important too. So sometimes when we go into an exercise program, we're like, all good, and we go and do one thing, oh, that's easy, and then we do like triple it the next time, and we fall in a hole because it's sore. So we don't want to be doing this, okay? We want little progressions, little steps. So this doesn't work, okay? This creates pain, it's stop go, right? And you'll fall off that bandwagon really quick. This is what we want, okay? Goes up, and you might find that you reach a plateau, okay? So you might say, if we're talking, going for a walk around an oval, you might get to 4 laps and go, you know what, that's probably just enough for me for now. And you do that for a week or 2, and all of a sudden it becomes easy. So then we go to 5 laps, okay? But we don't go from 4 to 10, okay? Because then that's going to go bang down again, okay? So we want this, okay? Slow and steady, tortoise and hare, okay? Exercise can hurt, okay, but the pain should be at an acceptable level. So this is the 5, okay? Pain should subside back to normal within 24 hours. Okay, so we want this. Oh, we don't want this. So pay attention to that. Has anyone done this before? Yes? All right. How many people do this one? Right? How many people do this and then it just keeps going here? Right? So keep challenging yourself. So there's lots of barriers to exercises, okay? There's the hard way or the easy way, okay? Humans like to make lots of excuses, okay? We always make lots of, I don't have time to exercise. Okay, I'm sure you do. I don't have motivation to exercise. Okay? Build in a reward system. Or do it with a friend, as I spoke about before. I'm not getting the results. Sometimes results are hard to see. Sometimes you've got to look in the right direction for results. So as an example with my patients, they might say, you know, I get 5 out of 10 pain when I walk 100 metres. Okay. And then, let's say it's a month later and they go, how are you feeling? And nah, still no good. I get 5 out of 10 pain. Oh, how far are you walking? Oh, about okay. So if we look at pain, pain is the same. So pain hasn't improved. So I'm not getting the results. But I'm walking 10 times as far to get the same pain. So you've got to be careful about what you look at for how you gauge the success of the activity. Because 10-time improvement's pretty good, yeah? So look in the right places for results. I don't get support, okay? Build support network around you, okay? I don't understand. How do I exercise more? Okay? Ask the PTs. Ask a physio, ask your doctor. There's lots of people out there who can help you build a program that's appropriate for yourself. And likewise, give it a structure. Okay? So design a program that you're likely to comply with. There's no point saying, you know, I want you to go and do 10 sprints on the oval, because you're never going to do that. Well, you might, but you know, not likely. So build a program that suits you. Build a program that you enjoy. So take charge of your own disease. Listen to your body. Okay, your body will tell you. Sometimes if you know you're a bit wussy, don't listen to it too much, but learn to listen to your body. Okay. Use relaxation techniques. There's lots of different things you can do that actually will help you in the recovery process to make that exercise program be a little bit, easier for you. Do daily physical activity. Okay, don't go on and off, because it will build, and then you'll get the fitness benefits. The best exercise and physical activity is the one that you do, the one that gets done. Okay. That's the most important thing. If you take one thing from today, take that. Okay? And reward yourself when you hit your goals. You know, who used a star chart with their kids or their grandkids? They work. Build a reward at the end. So you know what, if I exercise my 5 times a week for a month, and I'll treat myself out for a dinner, or I'll buy myself that pair of shoes or a handbag, or whatever it is. You know, build yourself a reward so that, okay, you know what, I've achieved something. We all like rewards, we all like presents. Make that carrot at the end, and that's going to help you exercise better. Look at things like knee control. Okay? Look at things about how we load our bodies, how we move. Okay? Have the right posture when you move, because if you don't, you're more likely to feel sore and we're more likely to aggravate things. Don't sit down for more than 20 minutes at a time. Okay? Get up, move around. Avoid limping. Okay? Sometimes it's really easy to fall in a pattern of limping. Right? Work at getting that right movement pattern going, and you'll be surprised that you'll see that things will actually improve. You may not see it. Okay? One of the problems is if you live with something day on day, you don't see the change because it happens subtly. It's like watching grass grow. Okay, but you go away for 2 weeks, you come back and you go, oh my God, I've got to cut the grass. So other people may comment on how you're walking. Oh, you're walking a lot better today. Okay? So avoid limping. Avoid bad movement patterns if you can. Strive for the best body weight you can be. Okay? Often with exercise, it's not what we do that puts it out, it's what we're putting in at the same time. Do some strength training and make sure the joint can move through its available range of motion, so you're getting the optimum range for every joint that you've got. Physical activity is not harmful. It takes a lot to damage your body. Okay? It's when we don't do things well, or we progress things too quickly. Okay? Excessive inactivity is usually worse than activity. That's the modern disease. Okay, we sit. In the old days we used to have to go hunt and gather and move around, and now we sit. Now we plonk in front of a TV. We sit in an office all day. When we come home, what do? We sit on the couch. So it changes, you lose all that muscle strength. And you don't get osteoarthritis by being physically active. Okay? So we don't talk about arthritis anymore as being wear and tear. Okay? We get wear and we get repair now. So we do that. So moving is your friend. Look at doing things differently. Okay? If it's hard to move, there's supportive devices out there that might help you to move a little bit better. Okay? You might break up your exercise a little bit to start with. Sometimes it's starting that's the hardest part. Once you get into it, your body actually craves it. So it becomes easy to do. So you might have to break it up a little bit more at the start. Divide the activity into smaller parts. So we talk about the sets and reps. You might do more sets of smaller amounts, of more reps, or less reps, sorry. Okay, so there's lots of ways we can do it. Break it up to get you going. Find different ways of getting that movement. Okay, so sometimes there's an easier position to do it in. So you might not like kneeling because your knees are a bit funny, but you might be able to do the same exercise, okay, in perhaps a sitting position. So there's lots of different positions that you can do an exercise in. Most exercises will have multiple starting points. Okay, or if it's a balance issue or something like that, there's different ways that you can do stuff. Lower your demands. So sometimes we set goals too high for ourselves at the start. We try and start too high, right? We might have to start down here and build ourselves up to that point. And where you need to, get help and support from others. So either, a peer who's doing exercise and, you need some support to get motivation, or a professional who can advise you on the best way to actually do the exercise. So the conclusion is basically hang in there. If you want to exercise, it will pay off in the long run. All right, it's a bit of a journey. You've just got to work your way through that journey. Okay? Listen to your body. You're the one who knows what's best for you. Okay, so you can get all the advice and things. Okay, but listen to your body. Questions?
Am I right just thinking that Pilates is good for core strength and Tai Chi is good for balance? Is that what you would say as a physio?
Look, the thing with Pilates, Tai Chi, yoga, a lot of them all will bring in different things. I guess Tai Chi is very good for core. With Pilates, one of the issues with Pilates is there's lots of different Pilates practitioners. So there's clinical Pilates, which is typically with a physio, okay, and they'll have a bit more disease-specific knowledge and exercise to fix certain things. But then there's a lot of fitness professionals who do Pilates as well, and they may not be quite up to knowledge on doing an exercise for a specific problem. Pilates on the whole is, yes, it's nice and slow movement and it helps to build your core. But you can do a group Pilates session where there's 20 people in a class, and if no one comes around and has taught you to contract your tummy muscles properly, you're probably wasting your time a little bit. So with any exercise, I guess it's the knowledge base that you bring into it and what you get taught. Tai Chi is probably a little bit more easier for as a group setting, but it's gentle movement and it's leaning and you're moving outside of base support. So from a balance perspective, it's really good, but you need strength to balance. So if I'm too weak to come out here, I'm going to fall over. So it does work on movement and strength as well. So it goes back to that thing of do what you like. If you love Tai Chi, you're probably going to get far more benefit from doing that than going to a Pilates class that you loathe.
I was just wondering about resistance training in the water, people are running, water aerobics.
Yep.
Is that sufficient resistance training?
No. The water exercise can be really good, but we don't live in water. Okay, so hydro is good, but we also need load. Okay, so hydro is good because it takes load off, so we can move joints through range without putting a whole lot of pressure through perhaps an injured area. But we also need to load the muscles because our bones actually respond to load and it actually strengthens them. So if you're an astronaut, you go to space for months, you come back, your bones are actually really chalky. Okay, and so they've got to be really careful how they sort of integrate them back into the world because they can break stuff really easily. So if you lived in the water the whole time, same sort of thing would happen. Your bones actually would demineralise and they're not as strong. So strength training is actually important because it puts pulling and pushing pressure onto the bones, which actually help it. So combination is really good. So it can be like the deep water running can be a really good way of actually getting your heart rate up without the pounding on your joints, but you should supplement it with some loaded exercise. That could just be body weight, because gravity is enough. That could just be doing some squats and some other sorts of things. It would come back to what is it your hip or your knee? Your knee. Come back to what your knee would tolerate, but then there's other parts of your body that you could certainly exercise which don't load your knee as well.
How do you know the maximum weight that you can lift? You just go into the gym and practice lifting?
Yeah, if you really wanted to do that, it's probably better to do that with someone so they could help you to go through that process because you're probably going to hurt yourself if you go too hard. but yeah, you sort of, it's a little bit of a guesstimation where you just got to work out what you think and then go up subtly, and then it's like working it through.
I was going to say, I was really pleased to hear that you're going to introduce the GLAD program. I have done it.
Yep.
And I'm continuing.
Excellent.
On, but it's nice if there's one local here that can be.
Yeah, we've got to work out sort of the process and where we do it, but I'm in the process of actually getting all the slide boards and stuff. So once we've got all that,
Announce it or?
yeah, we'll put some stuff out on through the gym, through the social stuff as
so
well.
how do your programs work within the complex of the?
No, we're totally separate. Our clinic's separate from the gym.